Good evening and welcome to RFL. I'm Richard French. Another day and unfortunately another slew of record-breaking COVID numbers. The total number of cases now topping 3 million here in the U.S. and the virus has now killed more than 130,000 Americans. And now President Trump is picking his latest fight, this time with the most trusted infectious disease expert in the country, none other than Dr. Anthony Fauci.
I think we are in a good place. I disagree with him. You know, Dr. Fauci said don't wear masks, and now he says wear them. And he said numerous things. Don't close off China. Don't ban China. And I did it anyway. I sort of didn't listen to my experts. So we've done a good job. I think we're actually, we are going to be in 2, 3, 4 weeks. By the time we next speak, I think we're going to be in very good shape.
Of course, we've heard many times before how great a shape we'd be just months ago. We were told that we were past this, and months before that it wouldn't touch our shores and it was all a hoax. It would disappear with the wind. Obviously, none of those projections have been right, and even late this afternoon, when the press secretary, if the president had confidence in Dr. Fauci, she refused to answer. That's where we are right now. Who do you trust, America, Dr. Fauci or President Trump? And the president also sending out this tweet, which again is riddled with factual errors, and I quote, "Breaking news, the mortality rate for the China virus in the U.S. is just about the lowest in the world. Also, deaths in the U.S. are way down tenfold degrees since the pandemic height." Now, we will talk about that with a doctor who will join us as a guest in a moment. But first, let me just do some basic fact checking. We are not even close to having the lowest mortality rate. We're 14th out of the 20 industrialized nations with the highest death toll. And that rate has not fallen tenfold by any means. As usual, the president is not letting facts get in the way. Speaking of Dr. Fauci, he had this to say about where we are and about death as a projector.
It's a false narrative to take comfort in a lower rate of death. There's so many other things that are very dangerous and bad about this virus. Don't get yourself into false complacency.
Texas, Arizona, Florida continue to be particularly hard hit. And let's begin with Florida. As you can see from this chart, the numbers, they're skyrocketing. Nearly 4,000 Florida residents have died from the virus already. The state has almost 250,000 cases, and it's seen averaging nearly 9,000 new cases every day for the past week. The hospitals on the ground, they're feeling the strain of the surge. At least 56 medical centers have reached 100% capacity in their intensive care units, and another 35, they're sitting at 90%. This ER doctor in Tampa says COVID hitting physicians as well as the people they are treating.
What we're seeing across the nation is that initially we were misguided that this is a disease of older people only. I'll tell you the truth, we're seeing across the nation young physicians in the front lines dying, young people dying.
Despite what is happening in Florida, the governor there still has ordered schools to open no matter what next month, with kids in classrooms, not online. And speaking of schools, hours ago, the Centers for Disease Control scrapped its guidelines that they just put out, saying new ones will be issued next week. Vice President Mike Pence, he announced the news during the first task force briefing we have seen in weeks. It was a surreal scene. So you ask, why the sudden change of heart from the CDC? Well, the move comes after President Trump tweeted at them saying he doesn't like their guidelines because they're too tough and too expensive. By the way, Dr. Fauci was not permitted to show up at the scene. And Dr. Fauci, we'll speak more about him later, but we now look to another state going the wrong direction, Texas. The state reported more than 10,000 new cases over the past 24 hours, which is unfortunately a new record. Hospitalizations have also more than doubled over the past 2 weeks, and health officials there are now worried that health centers will reach capacity in many areas. Take a listen to this doctor on the front lines in Houston explaining what he is dealing with.
I don't have enough beds for you. Let's just put it that way, okay? I don't have enough beds and you will die. I mean, it's simple as that.
And to echo, by the way, in Houston, we're getting reports more people dying at home here, afraid to even go in the hospitals. And the situation in Arizona also dire. That state seeing record numbers of cases, hospitalizations, and yes, deaths. The state now has only 145, this is for the whole state of Arizona, 145 available ICU beds total, the rest all full. Also, some patients in Tucson, they're being transferred to other cities or even out of state as hospitals there cannot handle the sheer numbers of infected people. Phoenix is also dealing with a surge, a huge surge, and I want you to listen to another ER on the ground, this time a doctor out of that very city.
I really wish that we could bring people into the hospitals and just for a few minutes show the kind of agony that we're seeing, not just from our patients, but overworked healthcare workers and people working under incredibly stressful conditions.
I want to bring in our guest, Dr. Gary Simon. He is a professor of medicine and also the director of infectious diseases at George Washington University Hospital. Doctor, let me start off first with what happened earlier today, and I'm going to pivot off of what the president said yesterday about basically sending everybody back to school come fall.
I want to reopen the schools. Everybody wants it. The moms want it, the dads want it, the kids want it. It's time to do it. Our mortality rate is right now at a level that people don't talk about, but it's down tenfold. So you look at deaths are way down from this horrible China virus, and it's a disgrace that it happened. Shouldn't have happened, but it did.
So, doctor, listen, I think I'm speaking for the plurality of the public when they hear that. They take with a grain of salt that there is politics maybe involved. But for parents out there, I count myself among them, when I look to Dr. Birx, Dr. Redfield coming up there on the podium, I expect that they are going to use science and medicine to try to figure out this moving target about what's safe and what's not safe to do. The CDC put out guidelines, and today they seem to backtrack. And I'm wondering, as a parent, and I speak, I'm sure, for a lot of our audience, how do I figure out what's right or wrong when it seems that politics and pressures are being exerted?
I think that's true. I think that this is mostly related to politics. The CDC has put out a lot of guidelines, which they change not quite daily, but almost, at least quite frequently. I think that sending children back to school has some associated risks. We don't know how bad the thing's going to get by the end of August. If opening up in other places follows what's happened in the southern states with opening up, things can get quite bad. In terms of children, I think we need to develop at least some approach to reduce the potential for disease transmission. Yes, children have a lower mortality than 70-year-olds, although some children have died. We need to be a bit more pragmatic about that and to say that, yes, there is some risk associated with it. And it shouldn't be a political decision. This should be a medical and scientific decision.
And of course, you enter in the equation the teachers and those that are support staff in the school and all the attendant adults that are obviously at higher risk. But more than that, to me, it's a microcosm, doctor, the problem we've had throughout this pandemic that we're one step behind, which is, okay, I can understand certainly the benefits of in-school learning, not just academically, they'll take more in, but moreover, for a lot of kids, it's where they get their school lunches. It's also, there's a socio benefit to it. I get all of those things. But you can't put 35 kids into a classroom, and you can't extort the schools by saying we're going to cut off federal funding when already state revenues are so low. Schools and school districts don't have the wherewithal to create the separation, to bring in the additional maybe people to help with not only keeping the kids apart, but safely and enforcing some of the guidelines. It's as if you're using a stick, but there's no even a carrot attached to it. So much of this, I feel, is being made up on the fly. Am I wrong?
Well, it's not just being made up on the fly, and we're not just one step behind, we're multiple steps behind. If you look at our mortality figures relative to other countries on a per capita basis, we're doing incredibly poorly. Now, we've improved our mortality figures by the very, very virtue of we are better able to take care of these patients than we were 3 or 4 months ago. We've learned a lot of things about these patients. But this resistance to wearing masks, the resistance to wearing masks is far and away the biggest problem we have in the spread of this disease. Yes, I think separating people helps, but the mask is the key. In my opinion, is the key feature. Now, are there ways to do this in schools? Yeah, there probably is. There's ways to reduce down the time students spend in school. By that, you could have two sessions. Many years ago, when I was in New York public schools and they were overcrowded, they had two sessions, a morning session and an afternoon session. Some of the teaching can be done online, not all of it, certainly. Some of the things that we like to have in schools, we may have to give up for a while. Maybe we can't have band, or maybe we can't have some of the sports activities. But I think we have to do the basic things in schools. And yes, I think people need to wear masks in schools. And yes, I'm worried about the teachers. But at the same time, I'm worried about many of our physicians who are securing these patients. And the teachers will need to wear masks. The students will need to wear masks. Any suggestion otherwise is purely political and throwing caution to the wind.
I don't want to oversimplify a very complicated subject with obviously a virus that we're still learning about, but can you give an idea to the audience, and Doctor, they're watching us not just in the Northeast, but they're watching us in Texas and California now, that if the president just came forward and said, I'm going to have a national mandate, everybody's got to wear a mask, how materially different that would, if we want to bend this curve, and hopefully we all want the same thing, how much of a material difference that simple statement, if enforced, would do?
I think it would make a big impact. Certainly there are people who are going to refuse to wear masks. I mean, he's setting the worst possible example.
You know, I just finished a book on the Spanish flu, and obviously you've forgotten about this more than I'll ever know, but the haunting parallels between some of the same mistakes made then and now, how different certain communities handled the outbreak then and now, and the mitigating responses. But the one thing, and subsequently I've learned, is there's almost always a second spike to these things. And in the case, if you go back 100 years ago, it was worse, the second spike. I'm not Chicken Little here, but come fall, when people don't know the difference between the flu and this, and if the virus mutates in any way, how worried are you that in the course of your career, we're not just looking at the worst thing now, it could be even worse a couple months from now, 3-4 months from now, from what we're dealing with?
Well, look, anything's possible. I don't know if we're going to have a second spike because we haven't gotten through the first spike, but things are getting worse now.
Doctor, I appreciate the time. Thank you so much.
Thank you.
All right, everybody, when we come back, a whole host of legal issues. Our panel of attorneys will join us to take a look at the legal stories in the news, especially all those issues involving, yes, COVID. But before we get to that, the woman accused of helping Jeffrey Epstein sexually abuse young girls, now behind bars, but there are many open questions about the case against Ghislaine Maxwell. After the break, we'll spell them out for you.